Hi, I'm Nader Sharifi, and I'm a prosthodontist from Chicago. I'm here to share with you an expert tip. My expert tip for today is based on an overdenture and doing an intraoral pickup. When we do an intraoral pickup, it's either at the beginning of the case or quite possibly later after a reline. And having the ability to do an intraoral pickup will always be necessary if you're interested in participating in overdenture therapy in your practice. So Zest Anchors has a kit, a burr kit called the Chairside Prep and Finish Kit. It has the burrs that are necessary to complete this process very well. One of my favorite burrs in there is the recess burr, and it cores out the appropriate space underneath the denture. Should also always confirm that we have cored it out sufficiently so that we have good tissue adaptation before completing the pickup, but that recess burr does such a nice job for us in cleaning that out. There's an undercut burr to aid in retention. There's a vent burr to create a vent hole. And that's a little sidebar on my expert tip is vent holes have been proven to not vent. Our excess material will always follow the path of least resistance. And so, truthfully, putting in 2 vent holes is oddly a great solution because you'll seat the denture, make sure that it's seated against the mucosa with adequate adaptation, and inject your pickup acrylic in one vent hole until it comes out the other vent hole. And so they're not really working as vent holes per se, more like access holes. Nonetheless, this burr kit also has a trimming burr, a grinding burr, and a finishing burr so that after we're done doing the pickup, we can clean it up nicely and get it ready to go for the patient to take back home. So having this kit available gives me all the tools in one place. And of course, we could purchase them individually from, say, Brasseler or Comet or other burr manufacturers, but Zest Anchor puts it together for us quick and easy and should be in any office that wants to do restorative dentistry on overdentures. And that's my expert tip of the day.